You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you are considering dental implants. My first guest is an expert on the topic. He's a board-certified oral surgeon. He's here today to talk about who's a candidate for dental implants. Dr. Wenk, welcome to the program.
Nice to meet you, Randy.
The main reason we invite you on the program, dental implants. So is it standard of care just about these days now? And so, like, no more dentures? Are we in that? Is that where you are today?
Well, they're absolutely standard of care now. Implants should be offered to any patient who's missing a tooth or that has a denture. There's a lot of patients out there that have a problem in their mouth where they're missing one, or they have a loose-fitting denture or a painful denture, and the implants can help fix that.
Okay, now before we get into the topic, let's talk about your background and your training. I mean, you're a medical doctor.
Yes.
You have an MD. Mm-hmm. And you are board-certified oral surgeon. Tell me a little bit about that. And when did you know you wanted to get involved in oral surgery or dentistry?
So after dental school, I matched at the University of Florida and did my medical training at the University of Florida and my oral surgery residency at the University of Florida.
Now, this is a big team. I mean, you have 8 doctors under one roof. Mm-hmm. And you do just about everything. We
have 6 board-certified oral and maxillofacial surgeons, and then we have 2 doctors who are fellowship-trained in facial pain. They treat TMJ, clicking and locking and popping, TMJ pain, headaches, facial pain. They've dedicated their practices to that. And then the 6 of us that are surgeons treat the surgical issues that we see in our practice.
Now, do people need a referral? Because I know you work with a general dentist. But do people need a referral to see you? I mean, if they see something like this, they can call you directly, get a consult, get information?
They can. We work with any dentist in our area.
Now, today's topic, dental implants. What are the different categories of patients that you see?
Well, it's a wide variety of patients. We have patients who are missing one tooth, and they want to get that one tooth restored or repaired or replaced with a dental implant, actually. There are patients who have multiple missing teeth, and they're tired of their partial denture that they have to set in the glass of water in the nightstand at night. There are patients who are missing all their teeth and have dentures that they can't stand, but they've grown used to. There are old patients and there are very young patients who need implants. There are patients born without some teeth. They're missing teeth. And rather than getting bridges or partials, we treat them with dental implants. Let's see, there are traumatic injuries, patients who one guy in particular, I remember, believe it or not, it was his daughter's wedding. Okay, he wasn't at the wedding, he was playing basketball with the groomsmen. He got elbowed, I think it was elbowed or shouldered in the mouth and broke a tooth. The tooth was non-salvageable. We took the tooth out, put an implant in, same day. I was able to make a temporary crown for him so that 2 days later, I believe, he was able to smile at his daughter's wedding.
So even if it's in the front, you can make it look, you can match with a dental implant. Mm-hmm. And now, how is it, by the way, that what used to take 8 months, 9 months, you say that can be done in a visit or 2? I mean, why is it so much faster now than it was not so long ago?
You remind me of two marketing terms, teeth in an hour and teeth in a day. Implants have come a long way. Is that true? Just about, it is.
Is that right?
It is. We can see a patient and perform a CT scan in our office.
You have one in your office?
We do. It's an ICAT scanner. It's not near the radiation dose you get from a medical grade CT. It's a very low radiation, and it gives us images where we can see how much is bone to the 100th of a millimeter in 3 dimensions. It's a really powerful tool and great for implant treatment planning. And going on a tangent, we can take those images and make a guide for surgery. We can email the images and our pre-planned surgery to a company